Hi, I am Tariq Iqbal. He is my father. He is the patient of bradycardia. My father name is Abdul Qadir. Previously he gone through the pacemaker, so where the not success. So success in the pacemaker was working, but the multiple infection was there in the body. So the pacemaker was not accepting. So pacemaker was seeing out of the body, out of the skin, because of the multiple infections. So we have multiple opinion to go where to go. So we like one of my friend suggested, and even though I came to know in the Apollo with the Dr. Somen sir also, we had a multiple discussion regarding to how to go. So this is the sir suggested go for the leadless pacemaker, which is going to improve his quality of life, because of the his age also is one of the concern. His age is almost 75 years. After multiple discussion, we came to know this is the one option. He'll be the best, and he's in the future going to improve the quality of life. He can be able to do better way. So after implant of leadless pacemaker, he is very good. Previously, he was not able to walk. He was very feeling very breathlessness, and sometime not able to walk, not able to go to washroom also. He's fully dependent on other dependent people required. Alone he was not able to walk also. So this I can say like a very good experience after implant of the leadless pacemaker, where the sir has suggested, and which we are after almost more than 10 days, almost 10 days gone, though he is feeling very good, and he is able to walk. He is going without any help also. He is going to washroom. He is doing everything independently. So just I wanted to say leadless pacemaker, whatever the Somens are told, so now I can say it's very good, and he's feeling very good. So this is the dream, he can be able to walk, and he can be able to do like previous work when he used to do before 3 years or 2 years, 1 year before. The one thing I just wanted to say, with the Dr. Soman sir, he's very kind and very good. I can say and where I was not first time I met, so he told whatever the supports, emotional, financially also sir supported. So and very good help, which I can say I got from the sir. And in the definitely I can suggest in the near future, if required, definitely consult with the Dr. Soman sir. Thank you so much, sir.
Namaste, everybody. I am Dr. Saumen. I am a cardiologist and cardiac electrophysiologist at Apollo Hospitals, Hyderabad. As you heard the story of Qadir Saab, he was suffering from severe bradycardia, a condition commonly seen at his age where the heart rate really drops down significantly, causing loss of consciousness and severe breathlessness, and spoils the quality of life. It's quite common in that age group. And appropriately, he was implanted with a pacemaker, a conventional pacemaker, and he responded well to the treatment. He was doing well. His symptoms had disappeared. But unfortunately, rarely the pacemakers can get infected, especially the conventional ones. And in his case, his pacemaker got infected, unfortunately for him, which was serving him well. And at one point in time, there was a lot of pus discharge, and his pacemaker was visible outside his skin. Now, this is a serious condition because in such situations, the pacemaker cannot be salvaged. Unfortunately, the pacemaker has to be removed. Even though it is helping us, it has to be removed, otherwise the infection never heals. It can become a life-threatening infection. So after a few opinions, they came to me, and I saw the wound, and it was very clear that we could not salvage the pacemaker anymore. And we decided to remove the pacemaker for his benefit. Unfortunately for him, the device which was implanted on the right side, we did not have the option to do a fresh pacemaker on the left side, because he did not have vein access because of a previous cancerous condition that he was treated for. Now, this was a very difficult situation for us to fix, because he's not going to have a pacemaker, and he needs a pacemaker because his heart rate is severely slow and is dependent on a pacemaker. In such circumstances, fortunately, we are living in an era where we have a beautiful innovation called leadless pacemaker, which is made just for this situation. So I discussed with the family about leadless pacemaker, and they, after a few contemplations, gladly accepted. Now, leadless pacemaker, for your understanding, is a very small, almost the size of a vitamin capsule device, which is directly implanted inside the heart. You could refer to one of my previous videos on leadless pacemaker where I've described this procedure in detail. It is implanted directly inside the heart, and it is absolutely devoid of the risk of any infection because it doesn't have the liability of leads and a pocket which is in the skin. So we removed his infected device in one setting. He was given a course of antibiotics, and within a few days, at the time when the time was right, we went in with a leadless pacemaker, and it was a pretty successful procedure. And his parameters were great, and he was discharged in a great condition in the next day. And within a couple of days, it was really heartening for us to see him walk back to the OPD completely independent. He had a smile on his face, and he is now pretty independent and without the threat of an ongoing infection. And we have done few pacemakers. Leadless pacemaker is a really breakthrough innovation in this particular area, and it has come as a boon for all of us, and it really solves a lot of headaches for us in this particular circumstance. If you want to know more about leadless pacemakers and their utility and the conditions where they can be implanted and their benefits, please don't hesitate to get in touch with us in our OPD. Thank you all. Namaste.